Thank you so much, and good morning, and thank you for coming out so early. My role here is as chairperson of this HPV session, and I wanted to introduce our panel, and I wanted to introduce you to the initiative that Canada started. We're having a little difficulty with the slides, so we're just going to go forward without the slides. In 2017, with a number of collaborators in Canada, the Federation of Medical Women of Canada went to our Parliament, and with all four parties agreeing, and as you can imagine, it's difficult to get all four parties to agree on anything, we had all-party agreement to announce a week of education around HPV vaccine. You know, in Canada, I do acknowledge that we are privileged in that we have HPV vaccine in the school system for boys and girls. And we are proud of that. That took a lot of advocacy work. That wasn't an automatic. But now that we have it for boys and girls in the school system, we are working to increase the uptake because we still need parental permission in order to vaccinate the children. We also know that the vaccine is approved for women up to age 45, both in Canada and the US. And in Canada, our national guidelines suggest that there's no upper age limit for giving the vaccine. The vaccine is warranted and recommended if you are at risk. Well, certainly the public doesn't understand that, and that's why we're having an educational campaign. We've called it Canada versus HPV, and we've tried to encourage lots of other countries to take up the mantle, to use the work that we've started, and to start educational campaigns in their own countries. And so our three speakers, with Dr. Faber at the end talking about MWIA, are from countries that have started an educational campaign in their country. And that's what we're here to talk about, how we do an educational campaign, what each country is doing in their own right in order to promote and understand the value of HPV vaccine. I can't continue and introduce our speakers without acknowledging the movie that we saw last night. The film on Michelle, Lady Ganga, if I'm pronouncing that correctly, was outstanding, was powerful, and was so meaningful. And so part of what we want to do is have that film seen worldwide, have people understand the value of screening, which is so important. But to my mind, the idea of prevention, of preventing that initial infection is paramount. And so we're talking about screening, yes, and here today we're talking about prevention. So thank you for sharing Michelle's story with us. We're very grateful. All right, our speakers today are Dr. Joshi from India. She's a specialist in colposcopy at the Krishna Medical School. Then we've had Dr. Teresa Rauer-Kirschgraber, who's a past president of AMWA, a professor of medicine and pediatrics at the Indiana University School of Medicine, and she will be speaking on behalf of AMWA and GAIAC. Unfortunately, Dr. Krishna from GAIAC is not able to be with us as she's in India with a family emergency. And then we have Dr. Sherry Lei from Taiwan, who's a past president of the Medical Women's Association, a founding president of the Asian Gynecology Oncology Group, and is currently professor and vice superintendent at the Shangung Memorial Hospital. They are going to speak about the educational initiatives in each country. So we have India, USA, and Taiwan. And then Dr. Faber is going to talk to us about our MWA initiative for all our countries in the next triennium. So thank you for being with us this morning, and without further ado, Dr. Joshi will tell us about the experience in India. I'm not sure if the slides are up or not. I'll let you go ahead. It's not coming up on here.
Hello. Good morning, everybody. At the onset, let me thank organizers for giving chance for me to represent India. We are now explaining educational initiative on HPV in India. We are doing for last 50 years in Kama Hospital work of prevention under Dr. Usha Saraiya. And we started with pap smears and visual inspection, and now we have got an initiative on HPV testing and HPV vaccination. So this educational initiative involves imparting knowledge to all, especially gynecologists, general practitioners, nurses, and paramedics, school health programs, and through that, adolescents, women groups, and general public. At the back. Next one. I got it.
Next slide, please.
Okay. This was the next slide where,
There you are.
yeah.
You're
Huh.
fine.
The methodology is that we are talking to group of women.
This one goes forward and back. So from the next slide.
Forward, next one, yeah, okay. We are giving knowledge through posters, group discussions, then lectures, paper and television programs, and we are using all the methods possible to educate the groups of women and groups of paramedics. Here you can see posters displayed, and this program, when introduction is going on there in a primary health center. And nurses, now I am presenting one study done for nurses in HN Hospital, Mumbai. And the study at the level of awareness against hospital nurses staff. What happened? Yes. So here, okay, I will use mine. The study of awareness among hospital nursing staff regarding cancer and HPV infection. And another aim is to study the impact of intervention and level of KAP studies in nursing staff. Material and methods, KAP study was carried out in 200 female nursing staff of Sir H.N. Hospital Research Center, Mumbai. It was carried out in 2 phases, pre-intervention study and post-intervention, and then the impact of intervention was studied in between pre and post forms. Data was collected through a questionnaire and answered by the staff, and it was analyzed. Awareness of HPV infection, there were 13 questions, all were answered before and after. For example, few questions are, have you heard cervical cancer? Yes or no? HPV is the main cause of cervical cancer. True or false? Wars are due to HPV infection. And then HPV infection can be detected by checkups, true, false, or some are not sure. HPV infection can be cured to overcome. True or false? Awareness of HPV vaccine, there were few questions about that. That was, have you heard of HPV vaccine? What does HPV vaccine do? It prevents cancer, prevents cancer of cervix or precancer, does not cure already existing cervical cancer, all of the above or no knowledge. Who is supposed to get the HPV vaccine? Schoolgirls, young adolescent girls, married women, all of the above or no knowledge. And these questions were answered by the nurses. And then intervention. The whole purpose of doing this study was to enlighten the nurses and all staff and not to frighten them by asking such questions, what causes cancer and all. So they got knowledge, and intervention was carried out in 100 staff nurses, and illustrated talks, poster display, questions and answers, and whatever methods we told were done. And they were taken in a group of 30s, and slide,
Just tell her when you want it to go forward.
So this is the group of where we are telling. Next one, nurses study, and these are the questions about awareness on HPV infection. After that, next one. Next one. These are awareness on HPV vaccine questions, whether they knew about it, what does HPV vaccine do, and next one. And as I said, all this information was given to them to enlighten and not to frighten. Next, the group of nurses, examination was taken for them in the group of 30s, and they were for practical also, especially for VIA or studies. Next one. And then counseling in HPV infection was done for the symptoms. And it was told that HPV positivity, it does not mean that she has cancer. So she should not be frightened. And whoever is HPV positive or negative, after coming with the reports, individual counseling was done from them. And then HPV is not a sign of cancer. It only means that that virus is there. So, and HPV positive patients in general, they are 7 to 10%, but all of them don't have cancer. And cervical cancer is relatively rare, and it is in 1% of the above HPV positive cases. Next one. And it was comfortable that patients, nurses asked them, the patients, and nurses counsel them. So it was very important to give them knowledge and awareness about cervical cancer. And post-invention analysis data was done, and awareness level among staff improved significantly. They themselves came for checkups, and after that, they even brought their friends and relatives for HPV testing and checkups, and few of their relatives, small girls, for vaccination. So conclusion of the study is the importance of vaccination in health education along with personal health practice, should be equally emphasized to achieve successful cancer prevention. Next one. And then so there is a Chinese proverb saying that a picture can replace 1,000 words. So here are few of the photographs. A staff nurse educating a group of women. Second is inauguration of one of the courses. Third is a lecture for a big group of ladies. And fourth is, this is a camp picture. Next one. So, 50 years of dedicated service in creating awareness about early detection and prevention has led to light at the end of the tune. It is not all that India is definitely progressing. 50 years back, we started just with pap smears, visual inspections, and now great strides are expected now with education about HPV and HPV testing and use of HPV vaccines. Thank you.
Yes, thank you. Okay. So earlier this year, after approximately 6 months of work and efforts, we put together a webinar series that was sent around the country and actually globally. So I'd like to tell you a little bit about that program. It was put together with AMWA and with GAIAC in conjunction with a number of different organizations. It was centered at IU. We utilized our webinar service. It was done with a very minimal amount of costs. The timing for the program, thank you. The timing for the program was given by the institution and the staff to set it up. Luckily, we had numerous volunteers to help put the program together. And because it was done as a webinar, folks were able to present even from their homeland or from many states away. We appreciate the efforts of all to put this together, and we found that it was a very useful kind of a program. Okay. There we go. It was a week-long program during January, in which is considered to be the Cervical Cancer Week. It was set up long in advance, and so that every day there was a different program utilizing an expert, but also utilizing patients to tell their stories. We feel that the world could end HPV infections, and that's our goal. We made it similar to the program in Canada. Unfortunately, we couldn't get the US specifically behind it, so we used it as us versus HPV rather than the United States because we didn't have any official designation. Each day we had a different topic. So for the first one, it was about just the vaccine and what the vaccine entailed and who needed to be able to utilize it. We then got folks from around the world to give some discussion the following day, giving more of a global perspective of what was happening in other countries. Because there's some concern that HPV is only for women or only for girls, we wanted to incorporate those conditions that occur that are not necessarily cervical cancer related, and we actually included a couple of patients. That was probably the most impactful series, was when we actually had a 40-ish-year-old man talking about his symptoms having to go through head and neck carcinoma. But we also included his wife, who talked about the impact on her. That was one of the most watched series. The following two, each time was a little bit different. Each day we had approximately 200 people that signed in from around the country and globally. You got it? Okay. Part of the reason why we wanted this to be a more global thing is because we know of the burden both for women and for men and globally, and we wanted to be able to have an opportunity to be able to discuss this, not just with healthcare professionals. It was really focused on people. Anybody could listen in, anybody could send questions in, and having it done as a webinar meant that there was less stress on the people actually doing the presentation. It did require a lot of discussion ahead of time. We had practice sessions. We made sure that their equipment worked at their location. I don't know what he's doing. Okay. Can you go forward a few? Okay. Keep on. Can you keep going? All right, anyways, forget it. It worked out relatively well. Like I said, we had about 185 to 200 people every single time. We were able to do it on one time zone, but anybody could call in and look at it from a variety of times. We kept the webinars available so that you could sign in if you weren't able to see it at that specific time. We had a number of different organizations join in with us, and so that helped be able to get a wider audience. I think it's definitely a program that we're going to be doing on a regular basis. We like to incorporate it with other organizations. So I'd be happy to talk with you about it a little bit later. Thank you.
Madam Chairpersons and ladies, I don't see any gentlemen in this room. First of all, I would like to thank the organizing committee for inviting me to give a talk in this prestigious meeting. Okay, may I have my slide? In today's talk, I would like to share with you, but it is not going forward. The experience of cervical cancer screening program in Taiwan and how we incorporate HPV DNA testing into our cervical screening program. Can we have the next slide? Oh, here. Then the national vaccination program in Taiwan in conclusion. In Taiwan, cervical cancer is the 9th most common cancer in women and the 7th leading cause of female cancer mortality. Since 1995, the national insurance provide every woman age over 30 have a pap smear every year. And the national health insurance cover over 99% of the Taiwanese population. And the age standardized incidence of cervical cancer in Taiwan has decreased from it moved forward too fast. 29 per 100,000 women in 1981 and decreased to 8.63 in 2015. And age standardized cervical cancer mortality decreased from 7.14 to 3.44 in 2015. And you can see from this figure, since the implement of the pap smear yearly, it plateaued very fast, and there's no increase of coverage for 15 years. you can see that every year screening rate is 35%. Every 3 years is 6 year is 51%, and standard the rate stabilized at 70% till now, and the follow-up of abnormal Pap smear is around 90%. And this is the abnormal rate because those who come for screening are being screened out. So the abnormal rate is now under 1.5%. And we did a study of those who newly diagnosed as cervical cancer. Actually, 44% of them never ever have a Pap smear, and 7.1% of them never heard of it. And it's sad. Therefore, we asked them why they don't get a Pap smear. And they feel potential pain, and they fear of embarrassment, and this also related to the number of their sexual partner of the male consort. And if they do have one, they would like to do it. But we have to give this information to those women who do not come for the Pap smear. And we do know that the etiology of cervical cancer is HPV. Therefore, should we get in this HPV DNA testing into our screening program? Therefore, we have this general PCR of L1 region and have a hybridization to 44 subtype of HPV genotype. And this is the gene chip. And we can have this sensitivity down to between 10 to 100 copy sensitivity. And this is multiple detection in one hybridization. And we did validation compared to the hybrid capture 2, and the concordance is very good, 80%. And we did this to pass the Taiwanese FDA as the first medical device to screen women for their cervical disease. And we did a population-based study. We do a co-test, HPV and Pap smear, and those who have abnormal Pap smear, they came for colposcopy, and those who have normal cytology but HPV positive, they also come for the colposcopy, and the result is the prevalence, population-based prevalence is 10.8%. And the most prevalent three type is 52, 18, and 58. And we found additional case from the HPV genotyping. Therefore, from Pap smear alone is 82%, but with co-test can be 97.2%. And we also would like to know if those women are coming for Pap smear screening, if we give them the kit, they can do on their own self-sampling and get HPV testing. That would be accomplish their fear and embarrassment and something like that. Unfortunately, the response rate is very low. It's 2.85%. We mailed out over 10,000 women who do not attend the screening program. And there are 47 women have positive tests, but only few of them come back, and we found 2 cases. Therefore, I think that because the research need there to sign the informed consent, and we mail those kits. But if we just mailed out for everyone, I think the return rate will be better. Therefore, we asked the Administration of Health Promotion, maybe we should do it from the government, because from research, women are concerned, are not responding well. And for HPV vaccine, because this vaccine is available from 2007, many county or city, they pay on their own budget to sponsor the HPV vaccine for girl from age 12 and 13. And since the marketing of this 2 kind of vaccine, there's over 1 million doses have been marketed in Taiwan, but from last year, the national policy want to do a whole population based vaccination. And from our previous county or city-based experience, those adverse event is really not quite a concern. Usually, there is injection site pain and nausea, and those vertical and dizziness, you can just let them sit there for 30 minutes and it go away. And sometimes the media would pick up some girl with autoimmune disease. But since there are a group of experts there, we respond very quickly, and the implementation of this vaccination is going very smoothly so far. Conclusion, underutilization of Pap smear cause a gap in prevention of cervical neoplasm in many countries, such as in Taiwan. Therefore, we have to do research to improve the coverage of Pap smear and maybe add on HPV testing. And effort have to be made through public awareness, and our effort get together using HPV testing and HPV vaccination to against the war against cervical cancer. And this is very important for Taiwan and in the whole world. Thank you very much. And this is my team.
I think I'll start and hope the slides appear at some stage. Good morning to you all. I'm going to talk about HPV and the elimination of cervical cancer, a role for MWIA. When I become president of MWIA later this week, one of the major projects of my 3-year term will be HPV vaccination and the elimination of cervical cancer. This is a subject which is important for every country, rich and poor. I shall talk about the power and potential of partnerships in this ambitious endeavour and provide a vision for MWIA involvement. Lovely. What role can MWIA play? We are a worldwide network of women doctors and medical students, which is a great asset, and our voice is influential. But we cannot work alone. There are already several major players involved. The United Nations launched an initiative on the elimination of cervical cancer in 2016, bringing together 7 United Nations agencies and partners. In May last year, the new WHO Director General, Dr. Tedros, put out a global call to action to eliminate cervical cancer. There are many smaller players involved. HPV vaccination by itself will make a huge difference. Prevention is better than cure, but vaccination is not enough alone. The WHO has 3 distinct initiatives. First of all, a comprehensive national strategy for HPV vaccination in every country. Secondly, cervical screening and prompt treatment of precancerous lesions. And thirdly, the early detection and prompt treatment of invasive cancers and effective palliative care. Our current campaign will be worldwide vaccination, and I shall concentrate on that in this talk. 84% of high-income countries, as defined by the World Bank, have introduced the vaccine, compared to 31% in middle-income countries and 12% in low-income countries. Affordability is a problem. The majority of unvaccinated girls are in middle-income countries, for example, Indonesia and India, where the vaccine costs are not subsidized by Gavi, which is the Global Vaccine Alliance. Supply of vaccine might also be a problem. For a few facts about the vaccine. It's a very safe and very effective vaccine. It's synthetic, not live. It's best given aged 9 to 14, before girls become sexually active. If vaccination is started before the age of 15, only 2 doses are required, otherwise 3. In future, 1 dose may be enough by itself. Several countries vaccinate young boys, for example, the US, Canada, New Zealand, Brazil, and Italy. Others plan to vaccinate boys in the future, for example, the UK and Finland. Some HPV vaccinations are paid for by the national government, some by Gavi, but many have to be paid for privately, for example, in Hong Kong, Thailand, and India. There's a great need to reduce the price and ideally remove the need for refrigeration. Now, the experience of Rwanda, I'm going to talk about that a little bit. It's a low-income country with a population of around 12 million. It's very interesting. After the 1994 genocide, Rwanda was ranked as one of the poorest countries in the world. Cervical cancer was common, but was often not identified and treated till it had reached an advanced stage. The Rwanda government partnered with Merck in 2010, and Merck agreed to supply 3 years of free vaccine. An awareness campaign was mounted. A network of community health workers, nurses, teachers, church leaders, and volunteers canvassed the parents and adolescent girls. And publicity, for example, via radio, posters, and drama, was crucial. As in many countries in Africa and elsewhere, there were cultural barriers. HPV is a sexually transmitted virus. Talk about sex is taboo. And there were rumors of a vaccine link to infertility. The main message was that HPV vaccine prevents cervical cancer. And vaccine uptake was an amazing 93%. But there's a concern about continued funding of the vaccine with the withdrawal of Merck funding and Gavi support. And Rwanda also needs an effective cervical screening program, which is not there at present. Reluctance to have the vaccine can be a very significant problem. There are various reasons for this: mistrust of authority, rapid spread of rumours via the social media, and unsubstantiated concerns about side effects, such as paralysis or infertility, and a supposed link to autoimmune diseases. There's a concern that the vaccine encourages sexual activity and promotes sexual promiscuity. As I said before, it's very important in some countries to emphasise that the aim of vaccination is to prevent cervical cancer, rather than discussing any sexual connotations. I shall just give you two examples of the serious consequences of vaccine hesitancy. In Denmark, in 2014, there were reports in the media and online about pain and tiredness after the vaccine. And HPV vaccination coverage dropped from 90% to below 40% because of safety concerns. Studies subsequently showed no causal relationship. There was a campaign, Stop HPV, Stop Cervical Cancer. It included a Facebook page, answers to parents' questions, and parents' trust is being rebuilt. A WHO-initiated peer group was set up to discuss the lessons learned, for example, in Ireland, the Netherlands, and Austria, and that has been helpful. There are problems in Japan. Since 2013, HPV vaccination has not been strongly recommended because of supposed severe neurological side effects. The vaccination rate plunged from 70% to less than 1%. Many parents and girls are still not willing to be vaccinated, despite free vouchers, and many doctors are reluctant because of court cases. So, what is MWIA's vision for the future? It's for each country and its government to decide what it will do in relation to cervical cancer and cervical cancer elimination. Each country can interpret the WHO guidelines to suit its national context. It will be the role of MWIA to encourage each national organisation to play a part in promoting HPV vaccination, and we will support them to achieve this. What have we achieved so far? We've sent a questionnaire to all MWIA member countries asking, is there a national HPV vaccination program? Is there a national cervical screening program? How are they funded? And are members interested in MWIA helping with a national awareness campaign? The Canadian and US medical women have run very effective national awareness campaigns. This is the Canadian logo, which I think is eye-catching and excellent. Here are a few highlights of the HPV Awareness Week in Canada and the United States. In Canada, the campaign was launched with MPs at the Houses of Parliament. There was a targeted media campaign. A kit of promotional materials was distributed to family medicine clinics. Educational materials were posted online. Social media was used extensively. And we've heard earlier about the excellent webinar series, which went on for 5 days. It was produced in the United States to educate the public and health professionals. And we hope that this can be used in other countries all around the world. I listened to it a lot, actually. I thought it was fantastic. The Lady Ganga film also has been mentioned before, about the cervical cancer patient and her trip down the Ganges, is also excellent, and that will be available for every country to show. It's very effective. Here are a few comments from our questionnaire on awareness campaigns. In Georgia, my colleagues are very interested. Awareness of doctors is very low. It's very important for us. In Zambia, cervical cancer is the most frequent cancer in Zambia at around 30% of new cases annually. Multimedia awareness is a much-needed intervention. In Nigeria, if well followed through, an awareness campaign can lead to introduction of screening and care for cervical cancer. Many thanks for this initiative. It's doable. And in Thailand, it's a good idea, but implementation is difficult unless we can reduce the cost of the vaccine to be affordable. So many countries would like MWIA's help in setting up an awareness campaign. And finally, what is the way forward? When the talking stops, action is crucial. Here is the plan. We're going to establish a project group under the leadership of Dr. Vivian Brown and Dr. Shobha Krishnan. We're going to work in partnership with the WHO and other groups. We're going to support national organizations in every country to engage with government and advocate for HPV vaccination. We're going to advise national organizations on awareness campaigns and supply appropriate materials. With the help of partner organizations, we're going to develop a sexual health and life skills curriculum aimed at adolescents in schools and youth groups. What is needed to eliminate cervical cancer? The political will and investment by governments and charities. We need to convince politicians of the economic, social, and clinical value of universal HPV vaccination. This is the first, most effective, and in many ways the easiest step. Beyond that, we need health workforce capacity building, education and training regarding HPV vaccination, and more broadly regarding cervical screening and treatment of cervical cancer. Cervical cancer services should be integrated into existing services, such as youth clinics, family planning, or HIV services. There are digital and mobile technology solutions, the use of apps and social media to engage and inform youth and the wider community, and technical assistance and support, the use of telemedicine, especially for cervical screening and treatment of cervical cancer in remote areas. These goals are achievable and likely to be highly effective. Thank you.
Thank you all very much for your interesting and powerful presentations. I think the underlying theme is really that by collaborating, by learning from each other, by sharing the experiences in other countries, whether it's teaching nurses, whether it's using webinars, whether it's doing self-sampling and DNA testing, I think when we collaborate, we all do better. And this is a disease, cervical cancer is a disease that is killing women, and we have the tools, we have the power, and we have the network to change the course of this disease. So thank you so much. Before we go on to the second aspect of women's health, I think we have 2 or 3 minutes for questions if anyone has something they would like to ask. Yes. Just speak up. Thank you so much.
I think there are 2 things I would like to say. One thing is such an initiative hopefully will bring medical women all around the world to stand up to protect women's health. I think that's very important. At the same time, you are mobilizing medical women to become our new members and also to make World Medical Women Association more visible worldwide. That's the first point. And the second point is in Taiwan, when I allocated the extra budget for the universal vaccination program, and previously when I launched, we tried to launch the HPV self-testing at home, we encountered difficulties from some feminists with ideological backlash against the HPV vaccination. And it's so important for the government to have women scientists like you and like Professor Lai to use evidence to educate the society and to support the government for such kind of initiative. So it's so important to have women scientists to work together with the government to make this initiative come true. So I would like to congratulate your efforts and your success in research. Thank you so much.
Thank you so much. There's a question behind you, and we don't have a lot of time.
No, thank you very much. We women are the ones who have a cervix. We do not need to make any more points that cervical cancer can be eradicated. So can we, as medical women, on this centenary celebration Congress, say that our goal is to eradicate cervical cancer, because we can?
Yes, thank you. Last question. And I should congratulate Australia. They've already published information in The Lancet last fall about their powerful numbers, that if their screening program continues at this rate and their vaccination continues at this rate, that in, I think it's 2024, they will have less than 4 cases per 100,000, which means they will have eliminated cervical cancer as a public health issue. So they are the first country in the world to be able to announce that. And I think we should have the goal that all countries in the world be able to announce that. Last question.
Yeah, thank you. Petronila from Tanzania. Our national association, while doing campaign of breast cancer screening, we realized that cervical cancer is #1 killer of cancers of women in Tanzania, followed by breast cancer. So through our campaigns, we had managed to have a pilot study of HPV in one of the regions, which was very successful. And last year, our government launched HPV campaign, but we are encountering problems which had been highlighted by Clarissa. The negative recipients to some communities associating it with infertility. So, as our national association, we would really like to have the support so that we take up the advocacy, educating our member of parliament, religious leaders, community leaders, and even among doctors, so that people get the right message. The second problem is sustainability, because HPV vaccine is very expensive. Now, we would like really to make a range like the other group, whereby you have 9 to 14 girls being vaccinated, but we cannot afford. So a group of 13 years were taken, and this is what created a lot of negative impact and discussion. Why 13 and not 14 and not 12? So we would like really to make an age range and integrated it with our already existing programs so that to make it sustainable. Thank you.
Thank you. That's the end of Clarissa. Sorry.
I just wanted to say, we haven't talked about this, but HPV also causes cancer in men, oropharyngeal cancer. Its incidence has increased a lot. Now, in Canada, I gather, a male politician who had oropharyngeal cancer from HPV helped the Canadian campaign a lot. So men are listening a lot now. So I think that's very helpful. Thank you.
Thank you so much. This is going to end the section on HPV in women's health. I want to thank our speakers, and you can step down now. And the second part of our women's health discussion will continue. So I want to invite the speakers for the second half to please come to the stage.